Okay, here's a quick one. True or false, blood pressure pills, blood thinners. They're basically the same thing. A lot of people might instinctively say true, right? It's super common to get these mixed up. But the source material we're digging into today, it shows that's actually a pretty big misunderstanding, potentially even risky. So this deep dive, it's all about unpacking the really crucial differences between these two kinds of meds. Our mission really is to give you the clarity from this article, show why knowing the difference matters so much for your health.
And you can see why it's confusing. I mean, so many people, especially as we get older, end up on multiple medications. It's kind of natural to just, lump them together. But what this material makes absolutely clear, the core truth is, blood pressure pills are not blood thinners. Fundamentally different jobs in the body.
Okay, let's really get into that then. Based on what we found, what are blood pressure pills, antihypertensives,
Right.
right? What are they actually doing?
Well, the key thing here, their job is to lower the actual force of your blood pushing against the artery walls. Think of it like easing the pressure in a hose pipe. And why does that matter so much? Because that high pressure, over time, really ramps up the risk for huge problems. Heart attack, stroke, kidney damage too. And the material points out there isn't just one kind. There are different ways they do this.
Right, I saw that. Some deal with fluids, is that it?
Exactly. You've got diuretics, which help your body ditch extra water and salt. Less fluid means less volume, lower pressure. Simple enough. Then others work more directly on the heart or the vessels themselves, like beta blockers. They can slow your heart rate down a bit so each pump isn't quite as forceful. And then you have things like ACE inhibitors or calcium channel blockers. These actually help relax or widen the blood vessels. More room for blood means naturally less pressure. So yeah, different mechanisms, but always the same target. Get that arterial pressure down.
Okay, fascinating. So it's purely about the pressure in the system. Now, switching gears to blood thinners. How does our source describe what they do? Sounds totally different.
Oh, completely different job. Yep. Blood thinners, they don't really touch your blood pressure directly at all. Their main role is all about preventing dangerous blood clots. The kind of clots that can form, break off, travel, and cause blockages. That's what leads to strokes or heart attacks if they block an artery to the heart, or even deadly clots in the lungs, pulmonary embolisms. And a really important point the material makes, that name thinners, it's a bit misleading. They don't make your blood run like water. They just reduce its tendency to clot.
Ah, okay. So that image of really thin, fast blood isn't quite right. And the article mentioned different ways they stop clotting.
Yeah, it breaks it down into two main types, basically. You have antiplatelet drugs. Aspirin is the classic example. These stop the little blood cells, platelets, from clumping together to start a clot. And then you've got anticoagulants. Think warfarin or some of the newer ones like Eliquis or Xarelto. These guys interfere more with the chemical chain reaction, the clotting cascade, slowing that whole process down.
Okay, so this brings up a really practical point. If they do such different things, pressure versus clotting, why would someone end up taking both?
Yeah, good question. And the material covers this. Often it's because someone has overlapping issues or risks, like maybe you've already had a heart attack or a stroke. You might need a blood thinner to stop another clot and a blood pressure pill because high pressure puts extra strain on your already stressed heart and vessels. Or say someone has atrial fibrillation, that heart rhythm issue that really bumps up clot risk. They might also just happen to have high blood pressure. So you use both together for double protection against different dangers. Each pill is still doing its own specific job, though.
Got it. So thinking about our listener now, maybe looking at their own medicine cabinet, what's the big takeaway for you from this deep dive?
I think the main message really hammered home in the source is that understanding what each of your medications does, that's incredibly empowering. It helps you manage your health better. Just knowing, okay, this one is for pressure, that one is for clots. It clarifies why you're taking them. And it means, you should feel totally comfortable asking your doctor or pharmacist, hey, what exactly is this pill for again? Why me? Never be afraid to ask. And obviously the crucial bit, never ever stop or change your dose without talking to them first. But knowing the difference helps you have those informed conversations.
Right. So the bottom line, crystal clear from the source. Blood pressure pills and blood thinners, absolutely not interchangeable. Different functions, different targets, but both can be vital, sometimes together, for heart health.
Exactly. Which kind of leaves us with this thought, doesn't it? Something to really mull over. Based on this whole idea of understanding your meds. In this world where medical terms can be, let's face it, pretty confusing, and you might be juggling several prescriptions, What does it actually mean for you to take real ownership? Not just swallowing a pill, but truly knowing why that specific pill is necessary. Is it tackling the force or is it preventing a clot? And knowing that distinction, what questions does that empower you to ask your doctor next time?